At this time, I would like to call on Representative Dr. Jasmine Clark, who serves as member of the Georgia House of Representatives for District 108. Representative Clark. Thank you.
Good evening, and thank you to Chairman Blair, members of the board, and welcome Superintendent Watts, and thank you as well. As you said, I am Representative Dr. Jasmine Clark. I'm the state representative for Georgia's House District 108. I'm the vice chair of the Gwinnett State House delegation. I also hold a PhD in microbiology and molecular genetics and currently work at Emory University as a lecturer in microbiology as well as anatomy and physiology and pathophysiology. I am also the mother of a Trickham Middle School student. First, I want to start with a full-hearted thank you to the board and former Superintendent Alvin Wilbanks for doing the right thing. Following the public health, science, and health experts and mandating masks in our schools, in the current political climate, that takes courage. If we want to keep the doors of our schools open, following the science will be paramount. As we can see with examples across the state where school systems that do not have mask mandates are having to shut down whole school systems and send everyone into virtual learning, or shut down whole schools, or send entire grades home within days of school opening. Following the science is effective and the best way to keep our kids in school, keep our teachers and staff safe, and do our part to reduce community spread. The decisions we make here have a profound impact on our ability to combat this virus. Currently, the Delta variant of SARS-CoV-2, the virus that causes COVID-19, is among us and spreading like wildfire. This has put a tremendous strain on our healthcare system, including, sadly, our children's hospitals. And while there's a lot of misinformation out there, I do want to make the science clear. You have a reduced likelihood of getting sick from COVID-19 if you are vaccinated. If you get sick while vaccinated, you have a reduced likelihood of being hospitalized, ending up in the ICU, or dying. Increasing vaccination rates among those who are eligible is good for our already overburdened hospitals and for those who are not yet eligible to be vaccinated. Currently, greater than 90% of those hospitalized in ICU or who have passed away from this virus are unvaccinated. Right now, pediatric ICUs, pediatric, that means children, are at 75 to 90% capacity. Because elementary school students can't be vaccinated and the vaccination rates among those 12 to 17 are very low, and we do not have access to information on vaccination rates per school or per class inside of our schools, universal masking is an important, effective tool in mitigating spread. We have lots of data and evidence and studies that show that masking works. It works best when both the source of infection and the person who is exposed to infection are masked. We also have evidence that mask mandates are associated with statistically significant decreases in daily COVID case and death growth rates. For every layer of protection that we add, such as distancing, cohorting, and hygiene, we protect our students, our staff, our community, our healthcare system, and our healthcare workers. As we know, for every rule, there will be those that try to find a way to break them. That is why I would also like to thank you for updating the guidelines for proper masks and prohibiting the use of masks with vents and valves and masks made of mesh fabric. I appreciate you identifying this issue and moving swiftly to rectify it. That said, I would like to bring up another vulnerability in our safety plan, which is lunchtime. So it's the one time a day where removing the mask indoors is permitted, and subsequently the same time that students are around the most other students. I would highly recommend that while we are in the midst of the current surge, that students eat lunch outside whenever possible or within classrooms in order to mitigate exposure. This method would reduce the number of potential contacts and exposures while students are unmasked, which would limit spread tremendously. Along with this, I am encouraged that GCPS is taking advantage of the Georgia Department of Public Health Surveillance Testing Program, which allows free testing of students, faculty, and staff. And I would like to encourage the board to implement more vaccination opportunities at schools, similar to what we are currently doing at Discovery High School.
Dr. Clark, we can't hear you. 1 second.
I'll repeat myself.
Yep, and before you keep going, I want to be mindful of folks in the room. We just made a message about decorum. There's also an expectation in this building that you have a mask on that covers your mouth and nose.
Thank you. I'll repeat myself for those who didn't get a chance to hear me. Along with this, I would like to encourage GCPS to take advantage of the Georgia Department of Health Surveillance Testing Program. I heard that that is something that you all are doing, and I thank you for that, which allows free testing for students, faculty, and staff. And I encourage more vaccination opportunities at our schools, similar to what we're doing at Discovery High School. Thank you for that as well. To close, I want to say thank you. Thank you for what you are doing, and thank you for being willing to do more. Your leadership during these tumultuous, politically charged, and frankly dangerous times is greatly appreciated. Thank you.